I always was interested in brains, and as I went through my residency program in neurology, I realized that working in the nerves and muscles outside of the brain and spine was really a puzzle. I've always enjoyed puzzles. So it's really about finding the right localization, where a problem is coming from. Neuromuscular medicine means that we treat conditions of the nerves and muscles outside of the spinal cord and brain, but it's still a part of neurology. The main conditions that I treat are ALS, so amyotrophic lateral sclerosis, which is a progressive neurodegenerative weakness condition. And so I see patients with ALS, people with myasthenia gravis, which is an antibody-related problem that interferes with nerve signals to the muscles, with neuropathies. First visit, I'm trying to first understand their background medical conditions, then understand the symptoms that they've been experiencing that led them to come to my office. So if they've got a symptom of numbness or tingling, when did that start? How did things change over time? What makes it better? What makes it worse? So trying to understand those things, then doing a complete neurologic examination to make sure that I get a good handle on where I think the problem is coming from. I really enjoy seeing people long term. That's part of what I enjoy about being a part of the ALS team clinic, that we follow these patients over time as they deal with a really devastating disease and try to provide support to both the patients and their families. ALS team clinic visit for our patients involves seeing me, my nurse, one of our physical therapists, occupational therapy, speech therapy, nutrition, social work. We have a community organization called the ALS Association that we work with when we're helping these patients, so they have a community base as well. We have pulmonologists and respiratory therapists that we work with. Many of our patients have palliative medicine providers that they're seeing, and at some point most of them will transition to a hospice setting, and so we're still available to work with patients and families even when they're in those last stages of their ALS. We're there to manage symptoms and help them deal with their condition for as long as we need to be there.